it's Allison with the Zionsville Chamber, and today we are here with Dr. Lowe, a physician at Witham here in Anson. So if you guys aren't familiar with the Anson practice of Witham, this is something that's really nice because it's here in Whitestown, Zionsville communities. Anyone can come here for a variety of reasons, but we're here today talking to Dr. Lowe because you have a practice that has all kinds of great things for people who are wanting some maybe elective procedures done. So talk to us about that.
Well, I'm a board certified surgeon in ear, nose, and throat, ENT, as well as cosmetic surgery. So we see both mainly general ENT patients here, but what's exciting is now I can bring some of my cosmetic surgery experience to this area. Mostly I've been based in Lebanon, and we've only in the past couple of months been over here.
That's nice.
So I offer free consultations discussing full body cosmetic surgery. So anywhere from face stuff to neck to breast augmentation to tummy tucks, liposuction, and then probably more commonly it would be the injectables. So
Sure.
Doing Botox as well as fillers.
So what does one of those conversations look like? So we're actually in one of the rooms that you use. And so not scary, looks like your typical doctor's office. And if she was going to do a procedure, this is one of those where, you know, she has brought some of the injectables with her that she can talk a little bit about. And tell me about these. So how long does an injectable last? What really is an injectable?
Okay, so do you want to talk about Botox first or
Yep.
more of the fillers?
Botox.
So Botox is probably the most well-known. We call it a neurotoxin because it's used to primarily treat facial wrinkles, facial lines. It's primarily used in the upper face. The reason being that as we get older, our skin loses elasticity, and so it kind of has that memory in it. So when you raise your eyebrows, that muscle contracts, and then the skin along with it kind of contracts in those wrinkles. And if it keeps going on and on, it will just, because it's lost that elasticity, create a deeper and deeper trough. That's hard to
None of us know anything about that.
So the purpose of Botox is to temporarily paralyze those muscles of expression. So most people don't like what we call 11s, so kind of the vertical lines that form kind of between the eyebrows because it makes people feel like they look angry or tired. So Botox, so I selectively Botox those three muscles in that area to paralyze them so that you can't really form that scowling face. And also in return, if over time, if you keep up with the Botox, those lines will go away because the muscles underneath the skin don't contract and don't keep forming that crease in the same location.
Oh, I did not realize that. I thought that it was just a procedure you had to keep up with indefinitely. I didn't realize that after a while it was actually going to take care of the problem.
I think it's because the muscle gets weaker because it's not working as hard.
Sure.
And so I've seen some patients, if they've kept up with it, they don't need as much Botox.
Wow, that's
And
fantastic.
So a lot of the most common questions get asked are, is it addictive? You know, what happens if you stop doing Botox? It's not addictive in the sense that you have to do it or you get withdrawal or something like that. But it's more people like the results. And so to keep up with the results, you have to keep doing it. Because Botox generally only lasts between 3 and 4 months.
Like getting your hair highlighted. Once you get used to having it look a certain way, you kind of expect with it. Yeah, you expect it to look that way.
And so after the 4 months, if you decide you don't like it, it just goes away just back to how it used to be. So it's not like it's worse than it was.
Sure.
And so I treat the lines around the eyes that we call the crow's feet, mainly the forehead. I can do a little bit in the brow to kind of help lift the brow. And then again, between the eyebrows is mainly the areas that I treat.
So if you have a procedure like this, can you go back to work after you've had something like this done? Or is this something where maybe you should do it at the end of the day or at the beginning of the day and, you know, just kind of take a day off?
I think for most patients, they're able to go, come do it on their lunch break and go back to work the same day. The only caveat is those patients who maybe bruise easily. Probably the most common side effect, if any, would be some pinpoint bruising. But if there's patients, maybe they're on some blood thinners or they're more prone to bruising, they may have a little bit bigger of a bruise.
Sure. So you could,
especially the eye area.
Oh, well, that makes sense, right? So could you work out that same day?
My rules are for the 4 hours after getting the Botox done. I don't want anyone to lie down and take a nap. I don't want them to go work out because you could potentially sweat out your Botox, and you don't want to sweat out your hard-earned Botox.
No, you don't. That's why you come and have it done, have it work.
Right. And so the thing about Botox is unlike fillers, you don't see the results right away.
Mm-hmm.
It takes about a week to sometimes up to 2 weeks for it all to kick in.
Oh, wow.
So that's the one thing. So patients, sometimes they want to get it done before a big event.
Mm-hmm.
They just have to realize, it won't, if you're having an event like that weekend, it won't take
Right.
effect
It's
by
not going to work.
immediate.
Right. Okay. I did not realize that. So what's the difference between something like Botox and a filler?
Filler. So again, Botox is mainly for the upper face. So that's where we mainly have the movement, and that causes the lines. Lines in the lower face and kind of cheek area, those are mainly from kind of the effects of gravity. So as we get older, the mid face especially, kind of this area tends to go gradually downward with gravity. And so what used to be high cheekbones now becomes jowls. Is kind of how it works, unfortunately.
Right, that doesn't sound real great. But
and also, as we get older, not only with gravity, but we also lose some of that kind of that volume as well. Not just from descent, but we just lose that volume. And so the purpose of fillers is to restore that volume to the mid face. So I generally put fillers that they last about 9 to 12 months, depending on the filler. Some last up to 2 to 3 years.
Wow.
And the fillers I like to use are made of hyaluronic acid. So it's kind of naturally occurring in the body. So what you would normally have, but as we got older, we kind of lost it. So I generally do it in a way that we kind of restore that natural youthful look. So not exaggerated. So it's not, people always ask me, am I gonna look weird? Somebody's gonna notice I've had something done, artificial. I don't do it like that. It's most people want a natural, rejuvenated look. And so that's what we go for.
Yeah.
So kind of, so what we offer here are Juvederm and Belotero. So both hyaluronic acid fillers. So with Juvederm, it's a smaller molecule, and I can put it pretty much anywhere in the face, except the under eyes. So usually patients will come into me to say, I just want to look younger. So we do that initial consultation, figure out, what bothers them the most. And then I tell them, when I look at you, this is what I notice. And, for the most bang for your buck, this is what we should treat because that will give you the biggest results.
Sure.
So oftentimes it requires, some filler up in the cheeks, kind of restore those high cheekbones. Sometimes it's those lines around the mouth, kind of what we call nasal labial folds, can be kind of deeper, so we try to fill those. Sometimes it's, in addition to jowls, you get a little depression here as we get older, and that kind of makes the jowls more apparent. So kind of filling that area also camouflages it. And then another side effect of aging is the lip tends to turn inwards. So what used to be a natural, youthful, full lip has become rather thin. So I also put some in the lips to kind of make them fuller.
So there's actually a couple different types of filler that you use. Tell us about the other type of filler that you use.
So another area that bothers people or feels like it makes them look older is the under eye area. So people complain about bags, hollowing in the eye area, which the transition between the lower eyelid and the cheek is called the tear trough. And so as we get older, we kind of lose volume because of that mid-face descent, and so it becomes an actual depression there. And so people may not feel tired, but they say other people say that they look tired, and they don't like that. So to fill the volume, I like using Belotero. So this is another hyaluronic acid filler that, again, lasts about 9 to 12 months, and it's specially designed for that area. The reason why I only picked this one is because sometimes if you put other fillers in there, because the eyelid skin is so delicate and thin, it can kind of show through, so it kind of looks like a bluish tinge under there. This one, because it's specially formulated for that, not so much. The main thing with that, it's kind of hard with the under eyes because they tend to bruise more easily, so we have to be a bit more conservative. But usually when patients come in, they buy the filler, and that is their filler. So if they need touch-ups, we save it, and they can always get a free touch-up later on because they've already gotten the syringe, and they know what to expect. So
That's
usually
fantastic.
we'll do one treatment, wait a couple weeks, let the swelling go down, and do another one.
So is this a treatment where you could go back to work, or is this something where maybe you take a day off and spend it rejuvenating yourself?
It depends again on bruising. You will, with these fillers, the product tends to draw in water. So for the next day or two, they might be more swollen than what you see. And the nice advantage about fillers is what you see is what you get. So right then you already see the results. And so usually patients might want to wait till the end of the workday maybe, or maybe a Friday, and then they can, get if there's any bruising, you can easily cover it up with makeup. But if you're worried about that, I wouldn't do it right before a major event. Maybe make sure if there's bruising, or if I think the main thing is bruising, I think is a major side effect of it.
Sure.
And so, especially in the under eye area, being so delicate. So making sure you don't do that like right before a big event, but you will have the results right away.
So if someone said to you, hey, I don't know what I need, a consultation, they just come in, they talk to you, you kind of take a evaluation of their face and say, okay, this is what I recommend, here's what I think that will give you the most natural, most youthful look, and can you perform the services then, or do you book another appointment?
Depends. We try to, if we think the patient is pretty interested, we usually, the thing with Botox, I can do it right then. There's no real prep work. We just, alcohol off the face and just start the treatment. With fillers, I use a numbing cream beforehand, and usually I like to let that sit for about 10-15 minutes. And the treatment itself maybe takes 15 to 20 minutes. So then just allotting enough time. Some patients, they just want a quick little consultation and come back later to schedule the visit.
Sure.
So that's the only thing.
Yeah.
Time constraints if they have any.
Well, and that's pretty minimally invasive whenever you're looking at overall procedures to really change how you feel about your look. That's a minimally invasive procedure.
True.
It sounds like you have, because you're a doctor, you have the skill set to be able to then go back and revisit some longer processes, like facial revision if they're looking for something that's a nose job or an eye lift. Those are things that you can also do.
Right. So some patients, usually they're kind of a little hesitant. A lot of them are just, dipping their toes into this area of kind of rejuvenation, facial rejuvenation, or cosmetic surgery. And so Botox and fillers are a little less intimidating. Then once they kind of get used to those looks, they want something a little more permanent. I can't fix like eye bags with fillers, but then after they've seen some fillers, seeing it's improved the appearance, then we start talking about maybe laser resurfacing, blepharoplasty, which is like lower eyelid surgery or upper eyelid surgery to more permanently give them a more youthful look.
Sure.
Or facelift, neck lifts, neck lipo. These are all things that I can't really treat with filler. We can help hide it a little bit, but for a truly dramatic effect would require surgery.
Right. And if someone was looking to do something like that, now they already know you because they've been in here as part of this treatment, or they've looked to you. How often are you here in this office here in Anson?
So I am here every Thursday in this exact office.
Well, and that would help people to know, if they were looking to do something on a Thursday, when they could schedule it, or kind of around their work schedule or vacation schedule, or kids, making sure that they had their kids taken to school and could pop by for a Botox treatment, or figure out what part of the day they could get their fillers in. So if someone was looking to get a hold of you, how do they do that?
So we have the ENT main office line, as well as a line to the like spa services for me. And so they could, through either of those, they can reach me and make an appointment. We try to be pretty accommodating. We understand everybody's busy, and these are not like necessarily insurance covered procedures, so they need to work around work, and we try to be flexible. And probably can get people in within the next week or so.
That's fantastic, especially if people are wanting to look a little more perky on those Zoom calls, because nothing on a Zoom call makes you look good, but maybe a little perking up would help.
I have noticed that since this all started, people are focusing more on like, oh, with the mask now I actually notice these lines.
Yeah.
It's true. That's what I've heard.
Yeah, well, I believe that because you can only see from here up, so.